ربنا
يعني
يخليك دكتور
الحقيقة
أحمد.
استفدنا يعني من حضرتك كتير قوي. الحاجة التانية طبعا كون إن أنا أدخل بعد دكتورة رنا. دكتورة رنا كانت معقدانا في الكورس، يعني كانت محسسانا إن إحنا يعني ضايعين يعني
ايوه.
فكون إن إحنا نجحنا مع دكتورة رنا فيعني ده سكسس، يعني ده شهادة في حد ذاتها يعني. آه،
لا
طبعا
دكتور
هو أنا
احمد،
ما
احلى
كانش.
حاجه انت كنت واخد الموضوع ايزي، ولو كنت بتقول لي لا انا مكمل معاكي لحد الدور الجاي، انت كنت متوقع جاي الدور
أيوه،
الجاي يعني.
ده حقيقي. الحقيقة ما كانش عندي وقت قوي، ولا مش بس وقت يعني. كنت مضغوط الفترة دي في كذا حاجة فما كنتش قادر ان انا ابقى مركز بشكل كبير الحقيقة.
اكتر
بس
واحد
ربنا.
بيضحكني يا دكتور احمد،
اه.
بس نكون من
قلت له
كده
طب
بس.
ما سالتش ليه؟ ما انا ما فيش وقت والله، مش فاضي.
لا، وبعدين الدكتوره دعاء بتقول لنا إيه، لو سمحتوا اطلبوا الفيدباك، قال لا احسن يرجعوا في كلامهم. لا يعني بتوقعني من الضحك.
لا الحمد لله، هو طبعا فضل ربنا يعني، والمجهودات الناس اللي عملت مجهود معانا، سواء دكتورة دعاء او دكتور احمد ماهر او دكتور محمد الفقي ودكتور خالد. الحقيقه يعني الحقيقه هو الامتحان فعلا براكتس، يعني هو الامتحان براكتس اكتر من فكره القرايه. كمان الجروبز اللي كانت حصلت، الدكتوره دينا برضو الحقيقه هي اول الجروب اللي كانت عملته، اول حد خلاني اورينتد شويه بان لا، ان الموضوع مختلف، لازم الواحد يعني ياخد الموضوع من وجهه نظر تانية، لازم لا، في كذا حاجات الواحد يبقى اورينتد بيها. ف... فلا الموضوع فعلا البراكتس ده مهم جدا، والواحد بيبقى لسانه بيتعود بقى، يعني من كتر ما هو بيبراكتس كيسز لسانه بيتعود على الكيسز. فالموضوع مع الوقت بيبقى اسهل واسرع.
مم.
الحقيقه لدرجه ان انا انا يعني انا يعني الحاجات اللي انا كنت ببراكتس عليها بقى الموضوع اسرع. وانا زي ما دكتوره دعاء قالت كده، اللي هو ايه، ما كنت يعني ايه اللي هو خلاص يا جماعه احنا عرفنا عنده كده وخلاص، فما بكملش الهيستوري.
مم.
لدرجه ان انا في الحالات اللونج كيسز انا فضلت يعني خلصت قبل الوقت بتاعه، بقيت عارف قاعد مش عارف اعمل ايه، فاهمه اللي هو حاسس يا
اه.
جماعه اكيد في حاجه. بس
حاجه
انا بس
ميسنج.
انا بس
مم.
انا وصلت يعني حاسس ان انا وصلت للدياجنوز، بس مش عارف اقول ايه. بس زي ما انت
مم.
قلتي برضو في الاول، الحاجه المهمه ان انت تعمل كل الخطوات افضل من ان انت تمسك في حاجه واحده وتعملها بيرفكت وتميس الخطوه، زي فكره الكونسيرن دي، ان انت تقعد
مم.
تسال هيستوري ديتيلز ديتيلز ديتيلز، وتنسى مثلا ان انت تسال الكونسيرن، او ان انت ما يبقاش عندك وقت ان انت تعمل اكزامينيشن. انا
مم.
الحقيقه كنت بسال يعني مع البراكتس ومع الكورسز. كان في خلاص الاسئله كانت بالنسبه لي بقت فاميليا، فخلاص وانس ان انا لقطت الدنيا ماشيه في ايه والدايجنوزز ماشي ازاي.
مم.
فخلاص بقى يعني ما كنتش الحقيقه بسال كل الاسئله علشان خاطر يعني احاول اقعد ارتب دماغي للاكزامينيشن وللاسئله. فدي
مم.
اول حاجه. بالنسبه بقى للكيسز، يعني الكيسز بتاعتي،
مم.
انا اول كيسز دخلت عليها كانت كيس كوميونيكيشن. تمام. الحقيقه
مم.
انا برضه عشان الناس اللي هي داخله الامتحان، انا اول ثلاثه كيسز انا جاي فيهم درجات مش احسن حاجه، بقيه الكيسز انا تقريبا جاي فيها الفول مارك
مم.
مني. ف...
مم.
فانا قصدي حتى لو انت دخلت اول كيس ولقيت ان انت الدنيا مش يعني ما عملتش فيها كويس، فاللي هو لا يعني عادي، انت ممكن تنجح وتجيب درجه كويسه يعني، فمش كيس ولا اتنين هي اللي هتوقع الدنيا.
مم.
فبس عادي يعني. فانا كنت داخل اول حاجه من منطلق ان عادي، ان انا خلاص يعني ان انا داخل عملت يعني عملت قدر اللي انا اقدر اعمله، حتى يعني لو لا قدر الله سقطت فيعني يعني قدر الله ما شاء فعل. فدي كانت مدياني لحد ما هدوء شويه. وحتى اول كيس لما عملتها حسيت ان انا لخبطت فيها شويه، فاللي هو قلت ايه، خلاص بقى بتعامل بمنطلق برود اعصاب وهدوء.
مم.
فده يعني ساعد شويه ان انا اعمل اتشيفمنت احسن في الكيسز التانيه. اول كيس جات لي كانت كيس بيشنت، كانت كوميونيكيشن. كان مريض كان عنده اي ثينك لانج سمول لانج كانسر، وكان عمل تقريبا عمل ريسكشن واخد كيمو راديو ثيرابي وبيعمل فولو اب. وبعد كده جاي بريزنتد اي ثينك ب ابدومينال بين على ما اعتقد، والانفستيجيشن بينت ان هو عنده فيه زي ميتس في الليفر. فطبعا دي كان ان انت تبلغه about his condition و discuss his concern. فطبعا انا اتكلمت معاه بالسكيما اللي احنا كنا براكتس عليها عادي، ودكتور احمد وبرزنتيشن والاجنده والكلام ده كله، و what do you know about your condition. فبدأ يشرح لي ان هو كان عنده كانسر، وان هو كان بي وان هو عنده كانسر، وان هو عايز يعرف يعني. فقلت له are you in regular follow up with your doctor regarding your cancer؟ قال لي اه انا كنت بتابع ولسه لحد وقت قريب بتابع. فقلت له I am sorry to tell you that you our يعني blood test and imaging showed that you have a cancer lung, and unfortunately this cancer is spread to the سوري كان to the ما كانش للليفر، لا كان to the spine. and
يس.
عنده and he has an acute urinary retention.
اه.
تمام سوري.
اه.
فقال لي how doctor I am on regular follow up regarding this cancer, and I think هو قال لي and the last 6 months I think I do a follow up and it was okay. How can I develop this؟
مم.
فما اعرفش، انا قلت له ما اعرفش هل دي صح ولا لا. انا الكيس دي كنت يعني جاي فيه 10 من 16، فانا قلت له
مم.
unfortunately small line cancer it is one of the rapidly progressive malignancy, and it may be happen within a short period and maybe disseminated to other organ, and unfortunately it is disseminated to your backbone, and it's causing what is called the urinary retention.
مم.
فطبعا ده كان الايه الحته الاولانيه، ان هو عايز يعرف ازاي انا
ليه
بفولو اب،
لوست؟ اه. مم.
رجعت دي اول نقطه.
مم.
الحاجه الثانيه كان المانجمنت، هاو تو مانج. فقلت له now we have to deal with your urinary retention to insert the urinary catheter, and then we will do a multidisciplinary team including بقى كل الدكتورز اللي في السبيشاليتي to put the plan of management
مم.
either if there is any rule of any intervention or just we have to do chemotherapy or radiotherapy.
مم.
فدي كانت الفكره بتاعت الايه ان انت هاو تو ديل ويز ذا اكيوت urinary ريتنشن. اه قلت له ان
مم.
احنا وي مي نيد ستيرويد برضه علشان خاطر الكومبريسيف.
قلل الكومبريشن. بالظبط.
اه
مم.
فهي دي ايه النقطة اللي انا ايه. فطبعا كان هو مشكلته ان انا ازاي انا بفولو اب، وازاي يجي لي القصة دي. والحاجة التانية المانجمنت هيبقى ازاي. طب هل انا هحتاج عملية ولا لا؟ هل هو هيخف ولا ايه؟ الحاجة التانية برضو من ضمن الأسئلة الكونسيرن. طب هل البروجنوزز هل it will cure or لا؟ فطبعا قلت له unfortunately this is an advanced stage of your condition, and there will a multidisciplinary team will decide the management يعني. فدي
يس.
كانت البتاع، ودي جبت فيها 10 من 16 يعني. ما اعرفش كان المشكلة في ايه، او يعني الحاجة اللي هم اخدوها عليا ايه في الكيس دي. تمام.
مم. تمام.
فدي اول كيس. الكيس الثانية كانت لونج. هي كانت عيانة عندها difficult swallowing.
يس.
فيميل لا او لا كان ميل بيشنت عنده difficult swallowing.
مم.
ايه سبب؟ فباخد الهيستوري زي ما انت قلتي كده برضو. انا سمعت اول جزء في المحاضرة
مم.
ان فعلا احنا في الكورس احنا بنتدرب على سيمتومز كتيرة في العيان علشان بس تفتحي مواضيع كتيرة، لكن هو اكشولي
مم.
العيان بيبقى عنده فيو سيمتوم بوزيتيف سيمتومز
اه.
بتبقى
بالظبط.
مش كتير.
صح. مم.
فده بيفرق معاك ان انت جوه الامتحان بتحس ان انت خلصتي بسرعه يعني.
مم.
او انا بقى مش عارف عشان انا ما بكمل يعني
مم.
ما بسالش كل حاجه ان ديتيلز.
مم.
فمثلا بحس ان انا بعد شويه خلاص. انا البوزيتيف فيه كان العين ان هو عنده جوينت بين وستيفنس مورنينج ستيفنس اكتر من ساعه، فهو خلاص روماتويد.
ماشي، روماتولوجي. مم.
ماشي روماتويد. فخلاص روماتويد. وبعد كده بدات اشوف ايه الديفيكالت سويلنج. بدات اسال على حاجات اللي هي اللوبس اللي مفيش. الحاجات اللي كانت بوزيتيف بس في الاسئله اللي انت كنت قايله لنا عليها، اللي هي بتاعت الجوجرين والابورشن والفور ديزيز اللي هم اللوبس والحاجات دي كلها، كان الجوجرين. تمام.
مم. مم.
كان بوزيتيف وانا اوريدي وصلت ان هو عنده جوجرين سيمت.
حلو.
بس الحقيقه بقى دي كيس برضه انا جبت فيها درجه مش كويسه. الحاجه اللي انا ما عرفتش ان انا ما قدرتش اربط ما بين الجوجرين والديفيكالت سوالنج. هو المفروض
مم.
الجوجرين بيعمل وجود الدراي اي والدراي ماوس
بالظبط.
وكده. دي في
اه.
حد ذاتها. فلما هو قال لي وات از يور ديفرنشال وات از ذا كوز، هو عايز يعرف الديفرنشال diagnosis اوف
مم.
difficult swallowing.
مم.
فانا الحقيقه دي انا ما وصلتش للدياجنوز، قعدت اقول له ميبي بقى سيستميك
Dr.
سكليروزس.
Ahmed, try to speak all in English because there
really.
are non-Arabic speakers here,
Oh,
and yeah.
okay, sorry. Okay, regarding the first long clinical case, it was presented by a male patient with difficult swallowing.
مم.
After taking the history, there is only a few positive sign and symptoms in the patient.
Yes.
And this is different from what we are taking in the course, because in the course we take multiple symptoms and complaint. So this is will help you to be practice more rapidly. So in exam, when you get a few symptoms, you feel that you finish early. Okay,
Yes.
so after taking history, the patient start to have I reached that he have a rheumatoid heart disease. Then he have also Sjogren's syndrome,
Rheumatoid
but
arthritis with Sjogren. Yes.
yeah, but unfortunately, I can't link that his Sjogren's syndrome can cause difficult swallowing. That's
Yes.
why when you ask me what is yours, the differential diagnosis, I not reach. I told him that it's maybe scleroderma, but I don't find the other criteria of scleroderma. Maybe the patient was taking non-steroidal. Told them maybe esophageal ulcer or gastritis due to non-steroidal.
Yes.
Then he asked me about the investigation for rheumatoid, how to investigate rheumatoid heart disease. Uh, then I think asked me about the management of the management.
Yes.
So
Yes.
actually I didn't do well in this case, and I got I think 18
Yes.
uh, from 29. Okay, then the next case. So the first two case, one 10 from 16, and the other is 18 from 28. The third case was short the abdomen. So I
Yes.
started to examine the patient. She was a female patient. She actually, I suspected that she is a thalassaemic patient,
Yes.
but I was not sure actually, because there is some prominent maxilla, but her skin was light white. So
Yes.
I think I will say thalassemia or not. I examined her abdomen. There was a clear splenomegaly and hepatomegaly. Hepatomegaly is large, and the spleen also is moderate to large. Then he told me, "What is your finding?" I told him that is there is a hepatomegaly. It is about a forefinger or 8 cm below the costal margin, below the right costal margin, and the splenomegaly. I think it was 9 centimeter.
Yes.
So he told me, "What is your differential diagnosis?"
Yes.
Uh, so I started with his hepatomegaly for differential diagnosis. Maybe I told by infiltrate disease, maybe lymphoma, maybe sarcoidosis, maybe. So he told me. Then why I answering this question? He told me, "What do you think about this spleen? It is considered large or small spleen?" So I told him, actually, I feel it is large, not small, of course, but it is large or small. I told him it is, of course, it's not a small, but maybe moderate or large. So he
Yes.
asked me, what is the causes of the large spleen? So I told him malaria, chronic myeloid leukemia. So he told me, what in Egypt, what in this country? I
Yes.
told him the Beheiry diseases. Then he asked me how to diagnose bilharziosis. What is the diagnostic? I told him that the OVA urine
Yes.
analysis or yani, urine
And or rectal
examination.
snap. Yes.
Yes.
Mm.
I think this is all the question. So in this station, I got 15 from 20. Okay, and
Yes.
later I met actually the patient later, and I told her, "Are you thalassaemic patient?" She told me that yes, I am a thalassaemic patient.
Yes.
Okay.
She could be a thalassaemic trait. They love to bring thalassaemic trait with no full picture.
Yes, maybe, but I
Yes.
think I might have, because I didn't mention that it is a thalassemia phase, because actually you have to suspect يعني, but as you told,
Mm.
don't invent an sign, so I am not sure
Better
it
than,
is a
yes, yes,
thalassemia,
yes, yes,
so I don't mention it. This is
yes.
the third case. The next case was
The other long clinical consultation, what was the case?
the other long clinical consultation. Yes, it was a patient presented, admitted in the hospital, male patient admitted in the hospital. He was presented by diarrhea for
Yes,
3 days. Then he
yes.
started to be confused and admitted in the ICU. Okay.
Mm.
Then there is no positive finding in the history except that he has a diarrhea 3 days ago,
Yes.
and then he started admitting in the ICU. Then his consciousness started to be deteriorated.
Mm.
On examination, when he asked me, "Did you?" I examined the patient. I examined mainly the abdomen.
Yes.
I examined the lymph node.
Yes.
And I ausculted lower limb and ausculted the chest rapidly. And
Yes.
also I examined the neck vein, and I asked it for the temperature, and I asked it for I think a glaucoma.
Yes.
Then he told me, do you find any positive finding in this patient in your examination?
Yes.
I didn't find any signs except that there is some harsh vesicular breathing. Okay,
Yes.
So I told him, actually, I'm not find any sign except his chest showing harsh vesicular breathing. Ali, okay. Then he started to ask me, what is your differential diagnosis? I told him that is my first differential diagnosis is this patient have diarrhea, maybe complicated by dehydration, which cause renal failure. A
Yes.
second differential diagnosis is what is called hemolytic uremic syndrome. So the
Yes.
candidate tell me, actually, this is the candidate tell me what I have, doctor. I told him that you have maybe developed this symptom due to the diarrhea followed by dehydration, and
Yes.
the other maybe due to the hemolytic uremic syndrome. So he told me what is the hemolytic uremic syndrome. I told him this is an condition happen when there is it's occur after an infection by an organism, a specific organism, which lead to the deterioration of the kidney functions. And okay, so after that, the examiner started to ask me regarding what is your differential diagnosis. I told him this is the same differential diagnosis, and in addition, I told him this may be also thrombocytopenic purpura. I don't know if this is correct or not, but I told it in my answer. Then he asked me, "What do you think the cause of his deteriorated conscious level?"
Yes.
So I told him that it may be due to uremic encephalopathy. So
Yes.
he gave me a paper with a platelet 27,000 and the hemoglobin anemia. I think it was 8. Then tell me after he gave me this lab result, can you tell me where there is other possible cause for this deteriorated conscious level? So I told him maybe there is a bleeding due to the decreased platelet, so he may have developed a bleeding, cerebral bleeding. So he told me what you want to investigate. I told him we have to do CT brain to exclude hemorrhage. Then he asked me about this patient was also complaining from bleeding bare nose. Okay, he told
Yes.
me this patient, if the CT was negative, no bleeding,
Yes.
is this patient need to give him a platelet transfusion? Actually, I was not sure about this. I told him, yes, I will give him. قال لي why? قلت له because the platelet is low and there is a nasal bleeding. قال لي, do you know what is the reference regarding the platelet transfusion? What is the reference number?
Yes.
I told him I don't know.
Yes. It's
Then he
below
told
below
me,
20. Below 20. Yes.
yeah.
Mm.
Then he gave me a paper with a
Mm.
medication. I
Yes.
think one of them is rivoxamine and
Rivaroxaban. Yes. Mm.
لا not rivoxaban, rivoxamine بتاع
Rivaroxaban. Oh.
rivoxamine بتاع medication of I think
ب... ب...
هو infection
uh,
blind gut infection
هيباتيك انسفالوباثي كده.
yes.
and in addition to paracetamol and in addition to pantoprazole. And he gave me, do you think this medication may be responsible for his condition? Actually, I don't know if one of this medication causes us, but I told him, actually, I will revise this medication with my consultant.
Yes.
And if one of this medication causes this condition, of course, we will stop it.
Yes.
Okay.
Yes. Actually, very, very
Uh,
tough case. Excellent. Excellent. You survived such a case.
Yes,
uh,
very
Yes.
difficult. But
Yes,
you
very
ran us
difficult.
a similar
Yes,
case.
we
Dr. Rami.
practiced hemolytic uremic in the course, but in that difficulty and the examiner is escalating the questions. Yes, actually, excellent. You survived.
I
actually,
think this TTB, thrombotic thrombocytopenic purpura, or
Could be.
what was
Yes, could
the
be.
I
Could
ending?
be.
felt,
Could be.
yes,
Yes.
I felt this from the differential. Then he asked me, is this patient need dialysis? I told him, actually, some cases may need a dialysis, but we will. He told me what is your management? I told him we will start with a multidisciplinary team with IV correction, and if there is any sepsis to correct the sepsis. So he told me this patient need hemodialysis or not, because also the lab's creatinine was 4 point something. So I told him some cases may need dialysis, but actually a lot of cases may be pass without dialysis. He told me again, yeah, so he may need to be in the permanent dialysis. I told him no. Actually, most of cases, even if needed dialysis, it may be for
For short
short
time.
period. But
Yes.
a lot of cases, yes, but a lot of cases may be recovered without dialysis. So he asked me, what is the lab you want to request for this? I told him I need to do an EBG for this patient.
Yes.
He asked me what is the indication of the dialysis. I told him if there is any uremic manifestation, if there is rising creatinine, if there is acidosis. He asked me what is. I told him I need to do an EBG. So, what is another investigation you want to do? So I didn't get in the first time. Then an important investigation you have to check in this patient. I told him I need to
Blood
check the
film.
potassium. قال لي okay good.
مم.
Then ايه
ممكن كان
then
blood film.
after
Yes.
that the time
مم.
is finished. Actually,
Finished. مم.
what I told him
Oh,
yes, this is the second long clear and I got the full mark in this
Wow.
case.
excellent.
Also,
Excellent.
actually, he was where he asking me. I feel that he is angry. I don't know why. Yeah, I was suspecting that I will not get a good mark in this case because
Yes.
he look and not smile why he asking me or not, but he gave
Yes.
me a full mark in this case.
Yes.
ما شاء
Okay.
الله.
ما شاء الله. ما شاء الله. Excellent.
Uh,
Excellent, Dr. Ahmed.
the second case, there is a second communication case. Actually,
مم.
I think it is a similar, and I don't know if it is a tricky or not tricky, but he told that there is a patient diagnosed with a cancer cecum, and there is a mets in liver. Okay, you are not the doctor of this case. The relative want to talk to the doctor, and the responsible doctor for this case is not available. So
Yes.
you read the file for this patient, and you will discuss the case with the relative. Okay.
Yes.
So I start with the agenda and greeting the patient.
Yes.
And I told her, yes, she told me that I started to explain what she have. And then her daughter asked me, how doctor, she was fine, how it is we discovered it this condition until it is spread to other organs. So I told him, I think it was the trick in this question. Why is this cancer cecum? We didn't discover it unless in this late stage.
Yes.
Actually, I told her that unfortunately, cancer cecum is one of the malignancy which is discovered later because he is growing in a wide area in our gut. So when
Yes.
it start to be symptomatic, it may be in late stages. And
Yes.
actually, a lot of cases may be
Missed.
presented
Yes.
by the so the second question from the surrogate. So, doctor, I am feeling that I am maybe responsible for her delayed diagnosis because I am busy and I have a lot of work. I may be not taking care of it. I told her, I trying to reassure her and to tell her that is actually a lot of cases may be discovered later, and we are here trying to start to give her support and to start the management.
Yes.
فدي كانت I think دي كانت the tricky point in this condition in
ده
this
بس
case.
you
The
answer you
other
answered excellent. Yes.
Yes, the other point is that there is she is busy and she maybe not able to take care of her.
Involved social work.
So yes, we involved the social worker for that. So, but another point, I don't know if it is true or not. One of our colleagues in this case, he told us when he starts. Yes, another point. The surrogate asked me, "What is the management?" I told her that we will start to do a multidisciplinary team and to discuss the plan of management. Either we will give chemo or radio, or there is any role if any intervention. So she asked me, so you didn't put a plan yet for this for the management? دي شوية I was hesitated, but yes, I told her that yes,
Yes, because
we will
you are
do.
not the only treating physician. You need to involve others. Yes.
Yes, yeah, I told it. One of other your friends in the exam, he told me that he gave you in the scenario that you are not a doctor to tell her that I am not his doctor. I just read the note from
Yes.
the system, and I am don't know about the management, but you will discuss this with the doctor. But I don't do that. I just tell that when she told me that I told her that we will put a plan of management by
Yes.
the different specialty like blah blah blah. So then he
Yes.
told me, so you didn't put the management is not started yet. I told her no, we will do a meeting and then we
And
will
then
decide
we will
the
start.
management.
Okay, okay. So, Dr. Ahmed, yes. Okay. So, if you are advising someone to start studying plan, I know you are very, very busy. You are cardiologist and you are very, very busy. How to not waste time and not waste money. يعملوا إيه؟ Give them يعني tips and tricks كده للpreparation
Okay.
سريعة. Hmm.
Okay, the first point is to practice. Okay, the
Yes.
practice is better than and to practice with other. Okay,
Yes.
another point. I don't know which center they are going to do the exam. Our friends, but I think for me, I take courses with Dr. Ahmed Meher for
Yes.
regarding the clinical and. I started with Dr. Meher, the
Yes.
first course, then the communication course. Then I started with with you, Dr. Dua.
Yes.
Even I was in while I was working, I was listening to the sessions
Yes.
and the practice as much as I can with during in the session. Then
Yes.
then after your recorded session, okay,
Yes.
and trying to get a notes. Actually, this practice may be more fluent in asking the question and to reach to the diagnosis because I think this has helped me a lot
Yes.
and to prepare myself to the discussion. So I think you have to take a clinical course, you have to see a patient, you have to do practice
Yes.
with groups, either in courses, either in your friends. You have to do practice. Don't study alone. It is يعني, you will not get any benefit
Hmm.
even if you some of cases I try to read in Roch and I feel that I get the case and it is okay but when it in a scenario you get it from the same case from a scenario, you
Yes.
will remember it, you will not forget it. But even if
Yes.
you got just read it and just a few days or maybe 1 or 2 days, you will forget what you read. Even
Yes.
if you feel that you are read it is good and you get to the point and you fit to practice this case. No, without practice
You will forget.
it will be difficult. So my advice, you have to have clinical as a friend of group multiple time.
Okay. Okay, Dr. Ahmed, congratulations. Thank you for your time
Okay.
and effort. Okay.
Thank
Doctora,
you.
thank you, Dr. Ahmed. Dr. Na'mat, are you with us? Dr. Na'mat,
Yes. Hi. Yes.
congratulations,
You.
Dr. Na'mat, for
Good
your
night.
success.
عاملين
And
ايه؟
yes, we are all ears to listen to your story.
اوكي.